All right, let's react to some TikTok videos.
Mas o que
Oh,
é isso na perna do paciente, velho? Aqui que ele vai
what
arrumar aqueles
is
bigatos
that?
aqui, ó. Esses bigatos aqui são
That
pontudos,
looks like a
ó, tá vendo?
knee
Eu
and
não tô
something
conseguindo
stuck
remover
in
ele, ó. Isso
between.
aqui é uma centopeia, ó. Tá vendo? Ela tá viva, ó. Olha aqui, velho. Parece aqueles... Ó, aquelas minhocas que tem pelo, velho. Aqui, ó. Ela tá viva. A gente vai tentar remover.
So that just looks like there's something stuck in between the knees. I don't think this is a medical condition or a tumor or anything like that. I think that's just something that he's putting in between his knees. I'd like to see him unclose and straighten out his knee and see what that thing is. It looks like a seed or something from the trees. And now we've got something that looks like a inside the mouth. So that was a tonsil stone. Okay, these are tiny little stones, or tonsillits is what we call it, that sits inside the tonsils. They smell a lot. They can cause halitosis or bad breath. Okay. So you've got a nasal laryngoscope going in. That's cool. That little pointy part is the epiglottis. Okay. We're trying to go in. The part that's closing, that's the vocal cords. It's the back of the tongue that's going back. It's very uncomfortable, this procedure. You might wonder why she's not gagging. They're giving her water so that swallowing motion can let the fiber optics, make the fiber go in further. I think the stuff they gave her is green. All right. So that was called the nasal laryngoscope. It's one of the common in-office procedures that ENT do in their office to get a good look. In this case, they're looking at the epiglottis as well as the vocal cords. Perhaps for patients with changes in voice and hoarseness, they want to make sure there's no cancer and stuff on the vocal cords itself. It's a little bit uncomfortable. You might wonder why she didn't gag. And that's because it bypasses the gag reflex when you go through the nose. It bypasses the back of your tongue. Got some earwax. That's a big one. This looks like a worm. Yeah, get it out. Oof. Damn, that is a big earwax. So I deal with a lot of earwax in my clinic, in our clinic. Our tools as family physicians are flushes and also looking in and kind of clear it out with a curette. One good way to use is to use hydrogen peroxide or Debrox for the over-the-counter pharmacy products to really emulsify and melt those oily waxes before we try to clear it out. It really makes the process a lot easier. I would certainly recommend against doing it yourself because you can hurt the ear canal. That sometimes might trigger an infection.
We did a survey. Yeah, 18 responses. But they were enthusiastic responses, so it feels more like 30. 8.5 by 11. I left my poster on the plane. More research is definitely needed. We certainly need to do more research on this subject. Yeah, these findings really set us up nicely for some more research. I really just can't wait to get in there and, sink my teeth into some additional research, I like your poster. Left mine on the plane. So okay. I thought we made eye contact. I'm really just here for the free trip. I don't know about your poster, but my conclusions are really not interesting. Yeah, we found something really interesting. I can keep explaining this, or you could just read it. Yeah, I don't know, like why are we here? Let me know if you have any questions. Happy to answer any questions. Please give me a question. Yeah, I agree. All of this could have been virtual. Well, none of the results achieved clinical significance, but it's still interesting. You know how...
I love this guy, Dr. Glomkopflecken. He's a legend. I don't think I know any medical student or resident who doesn't love him. It's too funny. This totally reminds me of my time when I did my research poster at a conference. That 99% of standing, looking awkward, flipping over your ID cards and trying to explain your lame research to people passing by and them pretending to be interested. Those eye contacts that you make and people kind of turning away right away.
Who are you? Medical student, what's your glove size?
Large? Hi!
Is your name on the board?
Hi, my name is Paul. I'm a third-year medical student. I'm going to write my name on the board here. Can't wait. He said I could be first assist today. My glove size is 7.5.
Oh, so you want me to grab them for you? Don't touch the blue.
I got it. I can go ahead and grab my gloves.
I grab the gloves.
Dude, I love this guy too. He's like the new, to me, he's almost as funny as Dr. Glomkopflecken. He portrays it perfectly. I remember when I was a medical student, you can't do anything right in the OR. These doors usually have a sensor, or there's some way to open it without using your hands, but sometimes it's just impossible to find.
Don't stand there. Can't stand there.
I can help roll the patient.
Nope. Not there. Don't touch the blue.
Yeah, I read up on all of the anatomy, so I'm 100% prepared for this case. Like anything he throws my way, I'm ready.
Quick, artist, album, and year.
You can study all you want. Sometimes the surgeons don't even ask you anything medical.
Delivering babies. I can't wait. Hi, I'm the med student on birthing suite.
Read the board. Jake, what are you doing, bud?
I'm learning a new language.
Hey, Jake.
OB rotations for family medicine residents and for med students is just, it's black or white. You either love it or you really don't like it.
Jake, Mom's comfortable with you being in the room.
What? Really? I never get these darn things on.
Almost there.
So beautiful. Everything.
Your role as a medical student, or even sometimes as a resident that's non-OB, is to be the hype man.
A woman covered in life-threatening tumors had 24 operations and a last chance to survive. 42-year-old Charmaine Sahadeo suffers from NF1 neurofibromatosis, a rare disease making it hard to eat, talk, and even breathe. Mrs. Sahadeo was terrified of dying alone as a large tumor, which she's called Frank, blocked her airways. Over 10 weeks, Charmaine had a shocking 60 hours of surgery, all while awake, to save her life. After the operation, she said, "Life is 100% better for me. You can see my nose, my mouth, and most important, I can breathe."
Oh, that's heartbreaking. That's terrible. Neurofibromatosis type 1 is a type of congenital condition. It's really sad because it's not just these nodules that's on her face. She usually, people with NF1 often have spine problems, really bad scoliosis. They can have eyes problems, nerve problems, mental retardation. It's a horrible disease. And all the wishes for her. That's rough, man.
Okay, no worries. All right, now I'm going to go ahead and close one ear. Can you breathe in, breathe out through your nose? Okay, same thing on the other side. Okay. All right, I'm going to check inside of your mouth. Go ahead and give me a big ah. Okay. Uvulus midline. Can you go ahead and try to push this wooden spatula with your tongue? Go ahead and open, and now push the spatula. Good. And on the other side. Okay, good.
I love her voice. It's so gentle. I know this is called ASMR, but wow.
Okay,
if every doctor talks to me like this, I'll be so comforted.
With the other hand.
What she's trying to do is a cranial nerve exam. There are 12 cranial nerves that controls movements and sensory sensation of your face, different parts of it. The part when she's telling the patients to push with their tongue, that's the cranial nerve 12. She's testing the hypoglossal nerves, the ones that controls your tongue.
Wonder what this feels like. Ow! That hurts! My God, is that what I've been doing to people?
Yeah, IVs are very uncomfortable, man. You got to go into the veins. That's this point for fluids to go in and for you to draw blood. It's uncomfortable.
Where's the boil?
It's down there,
Down where?
Sean. It's on her labia.
Is it painful?
Like I used a bowling ball for a tampon. Okay, boil shouldn't hurt that much. Okay.
I love The Good Doctor. The original, the Korean ones are even better, but this one is pretty good too. What she's talking about, labia is not the lips. It's one of the anatomy of the female genitalia. And the boils that's on there, the most common form is called Bartholin's gland. It gets infected, could have form a cyst, and it's extremely painful. That's probably what she has here.
That much. Okay, if we take a look. The swelling is fairly localized.
Extreme pain that's out of proportion to the visible injury could mean you have necrotizing flesh-eating bacteria.
What?
Don't say that to the patients. Yes, sometimes if you have infection on your skin that has severe pain, it could be a sign of necrotizing flesh-eating bacteria. But the chances are low. So before you're sure, you shouldn't tell patients that and make them freak out. Again, blue is sterile. Don't touch it. If you're a med student, stay away. Things drop, let it drop. Do not put it back. What's gonna happen after you put it back? Everything's gotta restart. They gotta take away the entire tray, you gotta set it up again. People will kill you if you do that. No. Don't do it. Don't do it. Oh, at this point, I mean, you're probably going to be expelled or something. I mean, I don't know how much cost it took for them to film this. That is crazy.
Ever wondered how a pap smear test is performed? Let's break it down. First, you'll meet with a healthcare provider. Don't worry, it's a routine procedure to check for cervical health. You'll lie back on an exam table, feet in stirrups. This might feel a bit awkward, but it's totally normal. The provider gently inserts a speculum into your vagina. This tool opens up the vaginal walls, allowing for a clear view of the cervix. Next, they'll use a small brush or spatula to collect cells from your cervix. This part might feel a little uncomfortable, but lasts just a few seconds. Once the sample is collected, it's sent to a lab for analysis. Afterward, you can discuss any questions you have. Results usually come back in a week or two. Remember, getting a pap smear is crucial for early detection of cervical issues.
Yeah, pap smear is very important. As a primary care doctor, I always tell all the patients to get it. Cervical cancer used to be the #1 killer of women, and since HPV vaccine was invented, that went down in list. But being able to detect cervical cancer early is very important. So everybody over 21 should get pap smear every 3 years. Once you're over 30, you can get a co-test that would be repeated. So it's still a pap smear with an extra test for HPV every 5 years. It's very treatable if it's detected early. So make sure you all do it.
What do we have here?
Yeah, definitely seen these in the emergency department. This is a plain film of patient's x-ray. This is their pelvic bone. That's their pubic symphysis. These gas bubbles are their colons. And you can see that there's a bottle of some sort. Not sure what material this is, but it's inside the rectum. So that explains the abdominal pain. Usually there's different type of reason or presentation or story behind this. Either they slipped and fell, or there was an accident, something like that. That's my reaction to all these TikTok videos. Hope you enjoyed. If you like it, please like and subscribe for more. See you next time.